Hi, my name's Lauren Errington. I'm the Executive Director of the Family Systems Institute, and I'm joined by Martina Palombi, who's an accredited mental health social worker and clinical family therapist working in Bondi. Martina joins me to talk about her most recently published article, which is part of the special edition of the Australian and New Zealand Journal of Family Therapy on Bowen family systems theory. Martina, it's great to have you here to just chat about your article a little bit. I just wanted to ask you firstly, what sparked your interest to contribute to this edition?
Yeah, thanks, Lauren. So I'd been working with this client for about a year and a half, and her presenting issues initially were anxiety and low mood. But then, because, as stated in the article, I work from a Bowen family systems theory framework, I was exploring a little bit more broadly. So asking her about her family of origin, as you know, is custom to do that from this approach. And what emerged was that there'd actually been quite a lot of stress in her interactions, both historically and at the time, with her mother, her father, and her younger sister. Now, her younger sister had been diagnosed with borderline personality disorder, and there'd been quite a intense history of violence, both physical and emotional, between my client and her sister, and the sister and the parents as well. So in exploring these relationships, I encouraged her to start to think about her part in what I would call the reciprocity between her and all her core family members. And she really was working very hard at what I would call her differentiating effort, which means that she was attempting to lower her reactivity and increase her emotional autonomy in all these core relationships. And what I became quite fascinated by was that she began to report that not only her symptoms started to decrease as she started to do this work with family members, but also her sister's symptoms started to decrease, and her sister's functioning increased quite a bit. So her sister ended up moving out of home. She ended up moving out of home in a different town to where her parents were living, and started to engage in a university program and was doing quite well. Her violence also decreased, and she seemed to be presenting in all her interactions with family members in a more mature way. So I thought, informed again by Bowen theory, I was very interested in how this case was unfolding, because it seemed to really speak to Murray Bowen's hypothesis around, that the symptom doesn't just reside within the individual, the symptom resides within the family system. And that when someone in that family is able to increase their level of differentiation, usually there's a ripple effect. And so the functioning of other members may increase.
Yeah, I have really appreciated your effort to kind of write this case up, and can hear, even in the way you're talking about it, your own curiosity, that got really sparked in working with this client and thinking about this family system. It got me thinking in reading it, Martina, that Michael Kerr talks about family therapy is family therapy because of the way the clinician thinks about the family, not necessarily the number of people in the room. And I wonder if you could just say a little bit about that. You're working with one person, but you're thinking about this whole family system and also observing other things that are going on in the family system.
Yeah, so this framework is very unique in that way, in the sense that both, there's a kind of couple of things around it. One is that we're not just looking and treating symptoms in an individual, because we're looking at the client really is the multi-generational family system. So there's that. And then there's the fact that in doing that, we're exploring all the interactions and maladaptivity that resides not just within an individual, but between family members in quite a complex way. So because of that, we don't need, like many other family therapy frameworks might need all the family in the room present. But because it's a way that we are thinking about, well, I don't want to say pathology because we don't really think in terms of pathology, but in terms of symptoms, as belonging to a family system, we don't actually require everyone in the room.
Yeah, thanks. And I wonder, Martina, just before we finish up, you mentioned before the real emphasis on therapy of working with this person around their differentiating effort. Could you just say a little bit more about what you see that effort towards differentiation including?
Yeah, so differentiation of self is one of the main concepts in Bowen theory. And it's really about both a person's ability to be able to separate out their emotional reactions and their intellectual system. So being able to be thoughtful in a moment when we're triggered. And also, excuse me, it's the ability to remain in contact with another person in a way where the person's not losing themselves, so giving up part of themselves, but also not avoiding the interaction. So it's remaining in contact with the disturbance that might be emerging in the interaction between two people, but at the same time defining self.
Great. And I'm sure people can read your article to find out more about what that looked like in this particular case example as well. That's great.
Yeah.
Thank you so much, Martina.
Thanks, Lauren.